Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you again on a wet, rainy Monday morning. But the sun looks like it's going to come out. We hope that continues. We have a great program this morning talking about some of the work that's gone on in nursing homes and other places with Dr. Jessica Kalender-Rich, who we refer to as JKR. But before we get there, Hawkeye, Medical Director, Infection Prevention and Control, welcome back.
Thanks.
All right, and pretty good news over the weekend.
Yeah, you know, I hope everybody did fertilize and seed earlier in the spring because we have really good rain coverage now. But
so now we're turning into a lawn and garden program.
Yeah, I mean, we have to just kind of throw some other things in there.
As COVID begins to go away, we're talking about grass. Let's go.
You know, but that's a positive thing.
Yeah.
I think all of this right now is pretty positive. You know, we have 7 active infections here in the hospital, with 2 in the ICU and 1 on the ventilator, still 10 in that recovery period. 6 of those 7 total patients were symptomatic, so they are being treated for COVID. And then Hays has 1 active and 2 in the recovery period as well.
So clearly a lot better than where we were 6 months ago. And throughout the United States and then locally, I was looking at the New York Times last night. They have those different things. We can break it down by state. And Wyandotte County is down 11%. Johnson County is down 22%. And that's on a 14-week rolling average. So we're seeing ongoing drops in both the states of Missouri and Kansas. So really good news throughout. You know, we know that the vaccine mask changes were lifted about 8 or 9 or 10 days ago, I guess now. So that's a big change. We're 9 to 10 days into that. We're really not seeing a marked increase yet in COVID-19 hospitalizations, which I think is incredibly important.
Yeah, and you know, the mandates were lifted, but I think there still are a lot of places of business that do encourage, you know, maybe not so much restaurants, but certainly stores do, and other places of business, which is a good thing as well. Just because the mandates are lifted doesn't mean the virus is gone, and we still know how to protect ourselves, and we still can. The best protection, though, is if we can get 100% of all those people 12 and over vaccinated.
So important, because that's the way to make sure from a long haul perspective, and I do remember both long haul syndrome and just because we're in this for a long time, if we're really going to keep people safe in the long term, it's getting people vaccinated, because we think that the numbers have dropped so far right now because many people have had COVID-19 infection, and combined with now 50% of Americans, or almost 50% of Americans who have had 1 shot, and about 1.2 million, 1.8 million getting another vaccine daily, that's good. But if you combine all those things together, there's a pretty significant number of Americans who've either had a COVID or gotten vaccinated. The struggle is that the vaccination looks like it's good for 8 to 12 months. COVID-19 infection may not be very good against some of the variants.
Yeah, no, exactly. You know, natural immunity, especially if you have mild or moderate disease or no symptoms, your robust immune response is not as robust, is not anything compared to the vaccination. In the vaccination, I think we do all anticipate to have a continued robust immunity, but also that memory function of that immune system for that 8 to 12 months as well.
Yeah, it's a big deal. All right, let's see if there are reporter questions out there this morning.
Hey, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Cody.
Hey, guys. And you kind of forayed into my first question here. Pfizer just put out a release this morning saying that the first participants taking part in their booster study got their shots today. I was just curious, what should we know about that, the need for boosters? And you touched a little bit on immunity just now.
Yeah, you know, we believe that with the messenger RNA vaccines, it's pretty clear that at least 8 months of immunity is bestowed upon you. We don't know how much longer, I think, after that, Hawkeye. But these booster studies will be very important. I know Moderna is doing some studies looking at boosters as well, with both combinations of different types of spike protein mRNA, in that it will help you specifically with the B1351 variant from South Africa.
Yeah, you know, we do have laboratory data of experiments looking at people who are vaccinated and looking at those experiments to try and neutralize those viruses or see the neutralizing activity against those variants, such as the UK and, of course, that variant that was identified in India. And the serum from vaccinated people in that initial benchtop lab work looks to be really good. So vaccine, we know, helps for the variants as well. But that being said, I would certainly would like and hope that if there is a pivot to a booster, that will be including some of those variant spikes, whether it's the South African and or the Indian variant spike, just to add some more specific immune response as well. So, but overall, right now, those mRNA vaccines really do look to have good protection against the variants as well, which is extremely important, especially now as we have seen that UK variant become the more dominant and prevalent variant in the United States.
So I think it's a really important thing for us to watch, but I suspect we'll all be getting our boosters around a year out. I bet the boosters will shift a little from year to year, and none of us should be surprised by any of that, because that's exactly what we do with the influenza vaccine.
Yeah, and I would hope that, again, I think it's all going to be towards tailoring the overall immune response to, again, protect yourself from getting any disease whatsoever, protect yourself from missing days of work. We know that's very important, the economic value of getting this, even if you individually are at low risk of disease and severe disease. Usually if you're still having symptoms, you have to get tested. If you're positive, the guidance is still to stay isolated for 10 days. So, in order to not miss work, I think it's important for every individual to get vaccinated.
Yeah, I think that's right. And I think so, too, that we have to stay abreast of what the changes are with with COVID-19 and how that evolves over time. So important for us to continue to get vaccinated until we can really get this thing totally out of control. What I hope is, over time, that this becomes a little more like the flu vaccine, where it won't be the political rallying cry and it won't be politicized so darn much as it has. And I think if I go back in time, because I'm approximately very old here, influenza used to be a little bit more of a fight to get people vaccinated, and it wasn't until different organizations started saying, look, we don't want people to be infected, so therefore if you're going to work here, you have to be vaccinated, that we really, I think, moved the ball here. I get a little worried when governments decide to step in, like state governments or local governments decide to try and step in and say, you can't make people get vaccinated from COVID-19, because and I'm not really even sure of the logic underneath that, except that it's just kind of a politicized issue. I think if we can get an FDA-approved drug out of this, and I'm quite confident that both Pfizer, Moderna, and J&J are all going to get FDA approval, then at that point I think it's going to be hard to argue that businesses or hospitals and health systems should not be allowed to require that, just as we do require that you've had a tetanus or an MMR or an influenza vaccine, because we do require those things.
Yeah, and if you remember, with influenza, we've never seen pork processing plants shut down. We've never seen supply chains shut down because people are infected. We know that for the economy to stay open and for us to continue to do what we want, vaccination is the way to help what we want to continue to do, and take that step back towards what things were like in 2019, because we know there are shortages right now, but we know there are supply chain issues. So that's very important to keep the economy moving, is to keep people healthy and being able to work. The other thing is, I think we don't understand how really lucky we are with these mRNA vaccines right now for coronavirus. I was just reading a published report today in Clinical Infectious Diseases looking at the 2019-2020 flu vaccine efficacy, influenza vaccine efficacy, and it looked to be about 32 or 35% in preventing disease. And now if we're talking about coronavirus vaccines with the mRNAs, you're looking at 90+% of vaccine efficacy. So we are extremely lucky that this technology and this platform has provided the protection that we have, and even the other adenovirus vector vaccines, which continue to provide great efficacy, much better than influenza vaccine. And to your point, some of those are mandated in work places and institutions, so why wouldn't coronavirus vaccine as well?
I think we just set a record for the longest answer we've ever given Cody.
Yeah.
Probably so.
Well done. One more question. Maybe you could answer more briefly. It's fine. Let's talk about...
We want to keep you on.
Yeah, that's right. So this is making headlines this morning. Potential rare side effects in a small number of teens and young adults. Heart inflammation with, I believe, the Moderna and Pfizer vaccines. Could you tell us a little bit about that?
You bet. So that broke yesterday afternoon. I think it's important to realize that myocarditis, which is what the heart inflammation is called, it's myocarditis, it's an inflammation of the heart muscle, can occur with any type of viral infection. And there's a specific rate, I believe it was 10 to 20 per 100,000. It's not clear that in fact, it looks like the post-vaccination rates of myocarditis are the same as the general population. So is it really different? I don't know the answer to that yet. I do think it bears further study. The important point is that this usually resolves on its own, and sometimes it requires some therapy with some steroids or other things, but it doesn't usually have permanent long-term side effects, although it can in the general population, because, again, myocarditis can occur normally. The thing you have to realize is that COVID-19 also causes myocarditis. The percentage is much higher than that, and the long-term side effects are much worse than that. So if you're going to weigh getting COVID-19 versus and what the background rate of this is against the rate of what we're going to see with the vaccination, I think we're going to find that the rate is much, much lower on vaccination. But clearly, this is something we're going to continue to keep tabs on. But at least from the preliminary data, and Hawk, I don't know if you saw that as well, it looks to be the same as that in the background. So whether or not that actually represents a problem due to vaccination, or it's just a problem that happens in young people, then I'm not sure we know that yet.
Yeah, and I haven't seen the info, but I think it's an important question to ask. But we've also talked about this and seen this before with other issues, vaccine versus infection, including blood clots. Your rate of blood clot is much higher with infection itself. Your rate of long haul or any of those other symptoms are much greater with the infection itself compared to the vaccine. I think it's an important question to ask and look at the data and identify and analyze it. But usually your rates of these severe outcomes or these adverse events are much greater if you get the infection itself.
I think what we have to remember is through the vaccine adverse event reporting system, or VSAFE as well, that what you find and what we forget is that there are a lot of diseases that occur naturally in the population. And then when you say, hey, look, we're seeing people who've had myocarditis, hearing loss, blood clots, things like that. The question is that at a different rate than already goes on in our country or in the world or with any population of people? What we look for is to see if the rate vaccinated is higher than what we understand the rate to be in the general population. And if it is, then we go back and we say, okay, what's the mechanism for that with the vaccination? So far, most of these things, and I suspect myocarditis is going to land here, are going to be the same in the general population as and with vaccination. All of which is to say vaccination prevents COVID-19, but it is not going to prevent diseases that occur that are not caused by COVID-19 that are true throughout the rest of the population. And I think that's just something we have to look at over a long period of time and figure that out. But you know, over 1 billion doses have been given of this vaccination, or one of the different types of vaccination around the world. I think what we're going to continue to see is that they're incredibly safe. Other questions? I'm not hearing any. So therefore, I get to turn to Jessica Kalender-Rich. Jessica is someone who I've known for a long time. She does a great job. She's a geriatrician here at the University of Kansas Health System, works within our population of those of us who are seniors or approaching that time, and especially in some of the nursing homes that we work with. And there's been some pretty big news here in the last week. Last week, the New England Journal of Medicine released a new study looking at the rate of decline and the vaccine effectiveness in patients in nursing homes. And just to say, JKR, pretty good news.
It's been fabulous news, and we can feel it. It's almost really like a palpable change in what has gone on in the nursing facilities. And we now are seeing that, yes, there are cases popping up here and there, but man, those vaccines are working. We started to see the rates decline right after, or even as that third clinic. You might recall that the federal government had rolled out these 3 clinics where they came into the nursing facilities to give vaccines to anyone who was interested. And at that time, we really started to see sharp declines, and it has continued.
So that's a really big deal. And so the data was strong.
Yeah.
Hawk. I mean, it went from like, I don't remember, 4.5% to 0.5% rate of infection. It was pretty impressive.
Yeah, absolutely. And that goes back to also what we are seeing here in our hospital. And the more of the statement is, what or who aren't we seeing? And that was those nursing home patients who have been coming into the hospital that have been vaccinated. We aren't seeing that anymore. But that was, I think about more than a 10 times reduction in the amount or the rate of nursing home admissions to the hospital because of vaccination.
And we still, I mean, we get nursing home admissions, but not from COVID-19.
Right.
So have you seen many patients leave the nursing home with COVID-19 since vaccination?
You know, there have been, I personally have only seen very few. There have only been a small number really across the country. Even if people are getting COVID-19, the symptoms have been really mild. And the rules out there are that once one person is identified, the whole community gets tested. We call it outbreak testing. And so since everyone is getting tested, we certainly are picking up early on some asymptomatic infections and some early infections so that we can intervene earlier and keep everything under wraps. But very few are having to go to the hospital or even seek treatment.
And I think that's an important point. You're still having infection, which we know can occur, but that spectrum of disease, especially even that disease where you need to seek some treatment, is significantly reduced, and all positive because of the vaccine.
In fact, one of the things we could do tomorrow is review that on our list of the patients who are here, and also review, because yes, we have 7 acute infections, but a number of those are actually asymptomatic and here for something else. Let's see if we can pull our numbers again tomorrow and go through that with our public, because it's such impressive information. When you look at it, you're like, really, we're down to 3 or 4 people who are sick or COVID-19. That's crazy good. So, JKR, this had to be the hardest year for our elderly who are in nursing homes. The mental trauma from this and the lack of visitors. So first of all, can visitors go back to nursing homes?
Visitors can go back. There are still some pretty significant restrictions on who and when and how, and every facility is sort of managing that differently. The statements that have been put out by CMS and others related to if the resident or patient is vaccinated, those people actually have more leniency in being able to see their loved ones earlier and being able to even touch their loved ones, whereas the rules are slightly different if the resident's unvaccinated, and that is really to protect that person, that older adult. That said, we're moving in the right direction.
Yeah, big deal. So how are folks?
So they're better. They're better. It's really hard. We all know, I think we all know now the trauma of being isolated, and it hit those people in nursing facilities, I would say for the most part, harder than others. They're getting better. I do think we'll see some long-term effects of some of the cognitive decline and some of the frailty that may have increased in the last year. But I'm hopeful that we will see some recovery also. And people are smiling again. It's a totally different world.
What worries you most right now with this population of folks?
That's a great question. You know, I really do think we have gone back to the same old things that worried us 2 years ago. You know, the same old move toward, you know, can we optimize your health? Can we make sure your medicines are right? Can we make sure that you have the right support system? And instead of us always thinking every time somebody has a cough and cold, oh my gosh, like could this be COVID-19? We really are looking at much more normalcy, and we're focused in on that whole person.
Yeah, such a beautiful statement, I think, and such a good problem to be back to, it feels like. We've talked before about faith, hope, and science, and what a difference that can make. And the story in our nursing homes is just that. I believe I saw statistics that, I don't remember what percentage of patients, but I thought it was like a third of all the deaths from COVID-19 had occurred from nursing home patients. Do you remember that? It's a huge number.
It was a huge number. There's a lot of different numbers that have kind of floated about, but it was huge.
So for people in assisted living or even independent living in residential communities, are they able to eat together again?
Yes. So even in long-term care, actually, those people that are vaccinated are eating together again, and that's really true across the whole spectrum of congregate care living.
So my mother-in-law often watches this program, and I can't say how old she is. She chastised me for reminding her how old she was each time when I said, "I'm my mother-in-law." We just call her Nani. Is at Dover Bishop Spencer Place, where I think they've done a great job around COVID-19, by the way. And they've opened up the dining halls, and it's still, you know, it's not quite what it was, but I think that that's so important because otherwise you're so isolated. And like isolation is bad at any age, but I think as you get older, man, that becomes a very difficult thing to handle.
what we saw from the isolation, especially from not being able to eat together, was people weren't eating, right? Like there's something social, but there's also something really cognitive about sitting around and eating with other people and having those triggers. And so it's so nice to see dining rooms open.
Yeah. Man, the dining rooms, Royals Stadium. Was it not nice to watch a little Royals baseball this weekend and see so many people in the stands? I can't wait to be one of those people. It won't be next weekend, but I think the following weekend, I haven't told my wife this yet. I should probably check with her first.
You just did.
I think it did. Hey, Sandra. Man, I think getting out to Royal Stadium sure sounds like a great idea to me. All right, let's see what questions are out there, Jill, from our community.
Well, I have one that I was wondering, recently KDHE Secretary Dr. Lee Norman was on, and he said that there was an uptick in the long-term care facilities, but he really thought it was employees. Is there any discussion about helping them with vaccine hesitancy or requiring that?
So, yes, most of the infections that we're seeing in the facilities are staff infections. Unfortunately, the vaccination rates for staff in nursing facilities remains really low. And right now, every facility is managing vaccination differently. Some of them have vaccinations available for the staff, and others are having staff go to other sites around the community, health departments and such. But at this point, it's really talking to each person individually. We have moved past the group of people that was ready to take it from the beginning, and now it's really about, talk to me about your issue, tell me what your questions are, how can we answer them, and really working one by one to try to get more people vaccinated.
Stephen wants to know, what will it take to get FDA approval, and why not now?
Great question.
Yeah.
We know that Pfizer and Moderna have gone to the FDA for approval. What happens is that the FDA, Hawkeye, I think they go through mounds and mounds of data, and we have to remember that because there have been so many patients who have had this vaccine across the country, and when the FDA looks at data, they're only looking at U.S. data. They don't look at international data. They look at what happens in our country. They look at that data and they say, okay, how have people really done? What's the benefit? What's the side effect? And they'll do a very extensive analysis, and they have to do that because they're looking at all the information that's come out with people who have gotten the vaccine through the EUA. Then that process takes a number of months, and there's often questions that the FDA has about data. They go back to the company. They ask, okay, produce this data, and they'll go back and forth through it several iterations. I know they're going to try to do this as fast as possible, but routinely it takes 3 to 6 months after applying for authorization that the drug can get approved. What I'm hearing about the vaccine is it's going to take 3 to 6 months for that for them to be approved.
Yeah, I think it should be a rubber stamp. I think it needs to be approved. If you look at other trials, just as you mentioned about CF drugs, but other trials and vaccines, you're looking at a few hundred people or a couple thousand people in which the trials were based on. We have tens of thousands, and now hundreds of thousands, millions. But the original trials were tens of thousands. So they do need to do the due diligence. That's what we've always stated. When there's been pauses or there's been changes in guidance, it's because of the due diligence of looking at these safety measures. So the due diligence is going to be done. The data is going to be analyzed, but hopefully eventually it will just be a rubber stamp because we have seen that these are safe and they are very effective.
And by the way, if you watch those commercials at night during a football game or a baseball game or whatever you watch, and you see those drug company commercials, and they tell you all the great things of the drug, and then they start listing all their side effects. They roll through those really fast so you can barely understand it. But what happens is that the FDA knows all that when they approve drugs. And so then it's really a benefit analysis. That is there more benefit than there is harm? I think at the end of the day, when you think about all those drugs you hear about, you watch that those people jumping around after they got this cool new asthma drug, or they got the great heart drug and their blood pressure is controlled, or their heart rate's controlled, or their Crohn's disease is controlled, or their atopic dermatitis, whatever, eczema is all controlled. And of course, all these drugs, rheumatoid arthritis, are all better. But then you start looking at the list of side effects and all the possible damaging things that can happen and all the risks you take when you take the meds. And yet, those drugs are approved. And they're approved because they do a lot more benefit than they do harm. So the question about COVID-19 is going to be this: if you take something that has already probably roughly infected 35 or 40% of the population, has a death rate somewhere around 0.5 to 1%, and you said, I've got a drug that's so darn safe because we're going to see very few side effects, and it looks incredibly efficacious. Is that drug going to get approved? Well, of course it is. Is it going to have the long list of side effects that you have on television at night when you see those drugs? Yeah, there are going to be side effects, but they're going to be far fewer than what you take whenever you have something like eczema or asthma or rheumatoid arthritis. And it's not that those aren't bad diseases. Those are terrible diseases. But the reality is that the death rate from COVID-19 is incredibly high. And so when you think about that, you think about the type of side effects they have, then the reality is that these drugs, these vaccines for COVID-19 are incredibly, incredibly safe relative to the risk of contracting and having the disease, dying from the disease, developing long-term side effects or long-haul syndrome.
Yeah, no, exactly. I mean, I think.
Lindsay says, it's been 6 months since my son had COVID. Would it be a good idea to have an antibody test done before getting the vaccine to see if he still has antibody protection?
No.
Our guide's time to get the vaccine.
No, just get the vaccine. There's no clinical reason to check for antibodies at this point in time.
Okay, Marianne said, is the Johnson & Johnson one-shot vaccine as good as the Pfizer two-shot vaccine?
Let's just go around the horn and see what everybody thinks. What do you think about for nursing home patients, JK?
For nursing home patients, any vaccine is the right vaccine.
Yeah, you know, I think we are looking at, it depends what you're saying is as good as. Right now we are saying as good as when we are looking at hospitalization, severe disease, and death. So yes, any vaccine you can get is going to prevent you from hospitalization, severe disease, and death. Overall will protect you.
Which one would you rather have? That's a hard question, but we got to be honest. Which one would you rather have?
The mRNA vaccine.
Me too.
Yeah, I mean, I think we have the best evidence with that right now. We have the best published real-world studies with that right now.
And I think we'll find out more. I think this July, I think J&J is supposed to be releasing data on their two-shot regimen, so it'll be interesting to see what their two-shot regimen looks like. We're going to see more data on the Pfizer-Moderna one-shot regimen. The reality is there's pretty good data out there. The one-shot of Pfizer-Moderna mRNA works 75 to 80% of the time, which is kind of in the same ballpark as J&J single shot.
Right.
So I think what we're going to find out is that the J&J will be 90% effective once you've had two shots.
And I think we should be thankful, and we're fortunate here. You know, we do have the mRNA vaccines. We have the Johnson & Johnson vaccine here in the United States. I think much luckier than some of the countries that are using the Chinese Sinopharm, which now you may have to get a booster at this point in time very early because it doesn't look like the efficacy is as good as what we've seen with Moderna, Pfizer, and J&J.
Yeah, and just to say, too, also published last week in the New England Journal of Medicine, AstraZeneca against the South African variant, not so good. Novavax looked a little better. It's about 50% effective, but much better than that at preventing serious hospitalization and death. So there's going to be more stuff coming out. I think the Novavax vaccine will eventually get approved in the U.S.
I'm still excited for Novavax. I hope that that does come. And, you know, just as with the mRNAs, with the spikes, you know, if you can put several different spikes into that vaccine, if you can put several different spike proteins into the Novavax vaccine once and if it is authorized and then approved, I think that would be great as well.
Isaac read that a French virologist said that the vaccine apparently causes variants to appear or arise. Have you heard anything about that?
No, I don't think that's true.
No, that might have been taken out of context. You know, there's always that concern that as you put pressure on, as more and more people are vaccinated and you get control of the virus and the spread, maybe that puts pressure on any variant to escape that immunity. But I think the overall message is that if you have vaccinated people, you have protection, you're actually going to do better at stopping replication and any possible chance that other variants can arise. So I think that's a complicated statement, but I would say that no, vaccine is actually going to help prevent variants from arising if enough of the population can get vaccinated.
Yeah, otherwise we would have seen variants in measles, mumps, and rubella.
Yeah,
I mean, right? I mean, that hasn't really occurred yet. I think the key is that COVID-19, the way the variants develop is through mistakes, if you will, in replication when the virus is reproducing inside your body. And any time we reproduce a lot, then that's when we have the ability for our genetic material to not quite go right and so for changes to occur. And the changes can be very random. So the theory could be that if you've been vaccinated, then your body's going to be killing this virus and therefore it's going to select out for the variants. The reality is that it's the replication cycle that causes mutations to happen and variants to proliferate. And as we know, in South Africa, for example, even without a vaccinated population, the variant, because it was more transmissible, became the dominant form in that community. The key with vaccination is to have strong vaccinations that work across all the variants. And so far, J&J and Pfizer and Moderna all appear to do that. So that's one of the reasons we like them so much. Also remember that they are more effective against the variants than host immunity, which is what you acquire when you've had COVID-19. And remember, finally, that having COVID-19 or getting a vaccination is really just a way of getting it happens in your body, is that you are going to be able to produce antibodies much more rapidly the next time you see it, and that's how you can stop the virus from invading so deeply and so profoundly and causing so much replication. So really, in the long run, you're going to help us if you can get vaccinated.
Isaac had a follow-up question for Dr. JKR. He wanted to know, how difficult was it to arrange the 2-shot vaccine regimens logistically in nursing homes?
So initially, there was government support to come into the facilities, and they had 3 scheduled dates, and that was logistically challenging, but relatively easy. Now each facility is doing it a little differently, and as they partner with either their long-term care pharmacy or with their county, everyone looks a little different. Some facilities are able to have, once we need 6 or 10 shots, we'll just drop off a vial and administer the vaccine. And other facilities are having these set dates that happen ongoing, but it's widely variable. I do think that as more vaccine has become available, many more hospitals are being able to give the first vaccine before people leave the hospital, which has then really cut down on the sort of logistical side on the other end.
JK, is it a requirement that if you come into a nursing home, you have to be vaccinated?
For the residents?
For the residents, yes.
For the residents, it is not. For no one, actually. For no one is it required that you be vaccinated to come into the facility. But if you're not vaccinated, and if you're not fully vaccinated, I should say, it looks a little different. So there is often an initial quarantine period once you get there if you're not vaccinated. That doesn't exist if you're vaccinated. And really that's all in an effort to prevent someone from bringing the virus in.
And so do you think that if it becomes an FDA-approved drug, and assuming it does, that it eventually will be required inside nursing homes?
I think that it will eventually be required for staff. We've never required any other vaccinations for nursing facilities, so I don't think that this one will be any different.
So just to say, we've talked before about what we'll do here at KU, and I'm going to guess we'll take more of a, provided there's not state laws that get in our way about it, but I think it'll be more like we deal with influenza, where we say for all employees you have to be vaccinated. I think we'll probably get there with COVID-19 as well. But there can be exceptions, although in our 14,000 or whatever number of employees, we only had 33 who did not get the influenza vaccine last year. So pretty darn good uptake, and I hope that we can get there with COVID-19 vaccination as well.
Pam wants to know, are the symptoms the same for all the variants?
They are. The base symptoms are really the same, Hawkeye, but they can be more severe. I mean, some of the things, and now there's this variant in India that may even be more lethal. So I think severity can be worse with some of the variants.
Yeah, I mean, that question is always being asked and arise. We thought that the UK variant was, but on further analysis, and there was a very good published Lancet paper a month ago or so that kind of looked at that, which actually didn't show any clinical difference. So not a lot of clinical difference. That question will continue to be evaluated. Of course, we do believe that there is just increased transmissibility. What exactly does that mean? Does it mean the virus binds easier or binds tighter to those receptors on our cells? We don't know, but right now, clinically, specifically, again, the best published data for the UK variant doesn't show that there's really any clinically significant changes compared to, say, one of the wild-type viral strains.
Susan wants to know, what autoimmune issues are affected by the vaccine?
I'm not aware of any.
I'm not sure I understand. I mean, or if the question is...
Exacerbate?
Yeah, can you flare autoimmune issues? That's not anything we've seen happen, and we've given, near 90,000 doses so far. I think 87 or 88,000 vaccine doses, and I don't think we've seen a flare. I don't think that's been reported. Are you guys seeing any problems from the vaccination in nursing homes?
No, we haven't seen anything.
And have you?
No, I think either to exacerbate or create any autoimmune symptoms or problems, I haven't seen any.
There's actually an editorial in the New York Times today about a person who has had a kidney transplant, and kidney transplant in general looks to only be about 50% efficacious.
Mm-hmm.
Well, that's not true. About half of patients have meaningful antibody titers after they've been vaccinated with only 2 shots. There's some talk about maybe even needing to get a 3rd dose, and it tends to look like the drugs that suppress your immune system.
Mm-hmm.
No surprise there. So for those people who have autoimmune diseases and are on immunosuppressant therapy, I think it is true. You have to be a little bit more cognizant of how well the vaccines work in that specific population. If you're on drugs like rituximab or CellCept, mycophenolate, Imuran, those drugs may blunt your vaccine effectiveness, at least in terms of the number of antibodies. However, it does look like there are decreased numbers of deaths coming out of the transplant community post-vaccination if they get COVID-19, but the numbers are still pretty small.
Mm-hmm. Yeah, I mean, the guidance for that immunosuppressed, particularly solid organ transplant, is still to continue to do the non-pharmaceutical interventions that we talked about, masking, distancing. We've seen some statements from some expert opinion saying, don't check antibodies afterward, and so kind of that's still the main focus there is continuing to have people do those safe things that we know about that work.
Okay, 2 more questions. Stacy wants to know, as a parent, based on everything that you said, do we hold off and look at the data for the kids, or do we go ahead and get them vaccinated? I think talking about the myocarditis.
Yeah, the myocarditis. Again, the number so far, what's being reported is the number of cases. I think there are 7 reported cases around the Pfizer vaccine, which, given the number of kids that have been vaccinated, came to the same rate as what you would see of 10 to 20 per 100,000. So I think I would not hold off, Hawkeye. I mean, you had your kids vaccinated.
Get them vaccinated.
I'm going to assume your kid's been vaccinated.
I only have one that's old enough, but yes.
Yes, and my kids are older. They've all been vaccinated. But if I had a 12 and over, go get vaccinated. I mean, COVID-19 is so much worse than vaccine, and even if the numbers are 10 to 20 per 100,000, that is much better than the rate of myocarditis or post-inflammatory syndrome or anything else from COVID-19. So I don't think this is going to turn out to be anything more than just that. And remember, just because something happens after you've been vaccinated doesn't mean the vaccine did it, because there are rates of disease in the population and amongst all Americans that occur without vaccination, and that's been true for a very long period of time. And one of those is myocarditis, which can happen, and it can happen after any viral illness, really. You can get it from an intestinal bug. You can get, and a good percentage of those, I think it's around 30% or 35%, are idiopathic, meaning we never understood the reason why. And we've been watching vaccines forever. I can't tell you, because of all the concerns about Guillain-Barré and different diseases that vaccines could cause, there's been an immense amount of scrutiny of vaccination. And so I really believe they're safe, and we have given COVID-19 vaccination to so many millions of people. I really believe that it's safe.
Sheila has our last question. She says, our care home did not allow flowers in the rooms on Mother's Day. Is this a CDC recommendation? Has the virus been found to be carried on cut flowers? She goes, I might note that the care home has opened up to visitors with checks at the door.
Mm-hmm.
So I've not seen, but maybe someone else has, any recommendations related to flowers or packages or any of the things that, more recently anyway, any of the things that we have sort of been working through over the past year. I think perhaps that might be kind of a holdover rule from our previous thoughts about not being able to touch things and the fomite transmission. And I would imagine that rule will change soon, but every facility is going to have to sort of come to terms with each of those rules on their own.
Yeah, I would agree. I think, understanding what is the actual risk, I don't think there's been any case of COVID being transferred on flowers or anything coming into the nursing facility like that. But it's up to every facility to, now take a thoughtful approach and look at what is the true way that this virus is spread. And then, get back to some normalcy, being able to, get visitors in if that's able to be done in a safe manner. But really look at, changing some of the processes that have been in place for over a year now as we know more.
So What a great conversation. I just want to say, if you want to go find a job well done, look at the job that nursing homes have done protecting patients through vaccination. I know JKR, you serve on a national committee about that. You're a member of the White House Coronavirus Commission for Safety and Quality in Nursing Homes. That's a pretty big deal. Anything you want to let us know about that?
No, I think that as more information comes out, we all, as a community of nursing home organizations, of providers out there, are just really feeling better. And I feel like we're moving in the right direction.
I think we should give you a round of applause for the great work that's been done protecting those most vulnerable in our population, because there's a lot of vulnerability inside nursing homes, and sometimes they don't always have the best reputation for whatever, but in this situation we have to acknowledge that folks have done a great job, and that we're just not seeing nursing home residents in hospitals from COVID-19. That's a big deal. It's a big statement. So thank you for that great work.
Yeah.
It takes a whole team. It's been a long road, and it takes a whole team. And every one of those CNAs and nurses and respiratory therapists and everyone that's out there, I'm grateful for all of them.
Yeah, it is great stuff. Hey, tomorrow, we know COVID-19 is a source of great pain to people who suffered chronic pain pre-pandemic and are dealing with the long-haul symptoms still. Dr. Rudhpa Sethi, Addiction Clinic Medical Director, and Dr. Teresa Long, psychiatrist, joined to talk about pain, opioid dependency versus addiction, and changes in guidelines that could be creating barriers to health care. All right, so we want to say thank you for sending in your photos of children getting the COVID-19 vaccine. Meet 14-year-old Addison and her 12-year-old brother Jacob. These photos were taken at a vaccine clinic recently with a health system. Their dad, Nate, works with us on Morning Update. You may wonder, who's getting Jill all these questions? Who tells her which ones to ask? Is she really magical on Facebook and doing it all at once? No, that's Nate in the background. Well, she is magical, but Nate in the background. He feeds Jill's questions from you folks at home. We asked Nate if his kids were nervous about getting the vaccine. He told us they made the choice on their own. You would have thought it was Christmas morning when I told them they could get the vaccine. They really wanted to get back to normal. We want to see more videos and photos of 12 and up getting the vaccine. You can upload images using Facebook Messenger here at the Kansas Health System, or send us at medicalnewsnetwork@kumc.edu. That's a big deal. We do all want to feel safe.
Yep.
And the way to be safe is not to avoid vaccination. Final thoughts.
I just want to say thank you to everyone out there in the community and everywhere for the support of the nursing facilities over the past year and a half.
Yeah, and I'm going to echo that too. My 98-year-old grandma in a facility in Rockford, Illinois. Thank you. It is sometimes a very thankless job, but it takes everybody, CNAs, nurses, assistants, everybody just helping care for our most vulnerable people, and have done a great job, been able to vaccinate. It has been hard for everybody, but I think if we continue to take those thoughtful steps, hopefully we can get back to normalcy and get those residents out of some of that isolation that they've had to deal with for the last year. But it is a thankless job, but keep on doing it and keep healthy, and hopefully all of the residents and all of the employees can continue to be vaccinated.
I'm not supposed to say my mother-in-law's age. I'm sorry, Nani, here it comes. She's 88.
Yeah.
And last year when she turned 88, we weren't together. She was in her apartment at Bishop Spencer Place and isolated, right?
Yeah.
That's bad. That's a hard thing, how many more birthdays do we have? And here you're spending one in the pandemic, isolated in your apartment, inside a place that's kind of on lockdown to make sure that people don't get sick and die from it. We didn't have vaccines then. We weren't protected then. And we were trying to make sure the technology worked so she could get on it. And that was hard, right? That was hard. And here we are vaccinated, our whole family, and she's vaccinated. Last night she's over for dinner. That just feels so darn normal. And it feels so darn safe. Faith, hope, science. We still need you. We'll see you tomorrow.